Now we can move on to two use cases of autonomy dilemmas. And what I'm going to want to try to do here is talk about actual examples of how autonomy questions, ethical questions, have arisen in the real world in artificial intelligence. These are both cases that I have worked on myself with other computer scientists and, in this case, doctors and lawyers, to try to think about how autonomy happens in the real world, in real AI devices. And so I've got two of those examples. One has to do with, one has to do with, the second has to do with insurance. The first has to do with healthcare. So we'll do that, and then we'll look at challenges to autonomy. But the first case is a healthcare case. This is a company I worked with, I guess it's been more than a few years ago. It's been a number of years ago now. But it's a good case. Cardisio. What this company did, or does, is they, you don't need to see a doctor or anything like that. It's just a private company. Just walk off the street, go into the office, and they will take an EKG of your heart, the thing of your heart going. Now, if you just watch on TV, you see the little line of the heartbeat. It looks like it's just kind of two little a big bump and a little bump, like chunk, chunk, chunk. But actually, it's not that. If you measure an EKG carefully, there are all kinds of little measurements that you can take in a heartbeat. Because as it happens, there's actually four, I think I'm remembering correctly. It's been a number of years now. I think I'm remembering correctly. Don't quote me on this. I think there are four pockets in your heart that are kind of move the blood through your system. And each of the pockets kind of beat in a kind of rhythm, an undulating rhythm here in your chest. And that creates a wave which is actually very complicated. It's not just up and down, like big, small, that kind of thing. There's all kinds of little measurements you can take, and that's what I show here on this slide. There are for every single heartbeat, you can measure all of these various distances in terms of time and in terms of strength, and that's just one heartbeat. You can imagine that going on over time. So what Cardisio does is they get those measurements, and this is a perfect case for artificial intelligence. Why? Because studying these heartbeats, just one EKG produces massive amounts of data, all these measurements you see, and that's way, way too many for a human mind to conceptualize or grasp. A human mind just cannot make sense of all of these many measures, and certainly can't compare all of these many measures over a whole line, let's say 5 minutes of my heartbeat, with those of other patients. It's just too much information, way too much, astronomically too much. But AI handles that easily, right? AI easily compares millions of data points, right, from my EKG, my 5-minute EKG, with that same number of data points with 100,000 other EKG strips that it has acquired or purchased on the market, right? And then once it does that, then the AI can find connections and say, look, Brousseau, your heartbeat is like these 3 other heartbeats, and I'm just making this up again. Bad news. These 3 other people all died of a heart attack within 2 months of having that kind of EKG. Or, let's be more optimistic, your heartbeat corresponds very well with these other 5 people, and good news, these other 5 people lived to be in their above hundreds before they had any heart problems. So great, good for you, right? Bad news, good news, who knows? But the point is that the Cardisio could produce this information much, much better. I mean, infinitely better than a human doctor. Human doctors can't even begin to compare with the kind of analytical power that artificial intelligence has in this little area, that is, of studying the EKG. Of course, human doctors can synthesize information much better between kind of your heart plus how you report you feel plus other kinds of things. So no one is saying that AI is replacing human doctors, but in this small area, yes, definitely. AI does it much better than any human, much, much better. And Cardiccio was in that business. And because this is non-invasive, they didn't need any medical license or anything, right? You just go in voluntarily. Very cheap and easy. They just put the things in your chest and sit there for 5 minutes. You're done. Go home. That's it. And they run the software. They compare you. And this is what Cardiccio did. They said, look, we compare your heartbeat with that of hundreds of thousands of others and all the little measures and things. And initially they produced two measures, green and red. Green was great, all good, don't worry. Red is, uh-oh, you've got a problem. Now, that sounds like, in the abstract, that sounds like it makes sense, right? That's kind of what you want. You don't want the green or the red. The problem is, where do you put that threshold? Where do you put the red threshold? If the Cardiccio EKG analysis shows that you have a 99% probability of dying within the next 2 hours, yes, that should probably be red, right? I mean, you want that information right now to go straight to the hospital. But if the Cardiccio thing shows that you have a 9% chance of dying within the next 9 years, and let's say you're my age, well, that's kind of, I mean, it's 1% a year, right? That probably kind of fits about with what you would think. I mean, it's really unlikely that someone my age is just going to have a heart attack, but the truth is it could happen, right? People at any age, really, when you get out of bed, young people die of all kinds of crazy things. Not frequently, but it does happen. So if you come up with, Cardiccio says, look, your heart is not perfect, right? It doesn't correspond with those people who lived to 100 and never had any heart stuff. It corresponds instead with these people who have this very slight risk. Well, should that be red or should that be green? This is the difficulty. Where do you draw the line? And we're asking this within the context of autonomy. Why? Because this is a big autonomy inhibitor. I mean, if I go to Cardiccio and Cardiccio says, look, so your heart isn't bad, you could die at any moment. I'm going to make all kinds of changes. First, I'm going to stop eating cookies. I love cookies. I'm going to stop drinking beer and wine and all that kind of stuff. My life is going to be a lot less fun. Right? It's not just less fun, but I'm going to diminish my own autonomy, or am I? We'll have to talk about this now. And it seems like maybe I'm going to diminish my own autonomy because I'm not going to let myself make determinations any longer about having beer. And should I have another beer or not? Right? Should I have another cookie or not? Because I'm worried that I'm deathly afraid that I'm going to die at any moment. So if you have this red prognosis from Cardiccio, right? I mean, you probably will limit your life. You will probably, maybe I won't travel because I don't want to be away from the hospital. Maybe I will move my apartment, move and live next door to the hospital. Who knows? It's difficult to be certain. But all these things certainly limit in the last examples, they certainly limit my autonomy, my ability to choose for myself. Just do I want to travel or not? If I can't travel because I'm afraid to be away from the hospital because Cardiccio has told me that I have this heart problem, well, that's taking away from my freedom to do what I want with my life. So this question about where you put the threshold is an autonomy question, right? Is it red only if you're going to die within a week? Or is it red if you might die within the next 10 years? Where do you put the red? Where do you put the green? And then one solution is you say, well, wait a minute, maybe we should introduce a new color like yellow, right? You say, look, red is for people who are really actually might die within the next couple of years, but have let's say a 50% probability of dying within the next 5 years. That's pretty serious. Maybe green is people who have only a 1% chance of dying within the next 5 years. And then yellow would be somewhere in between, or adjust it where you want. But the question is, and here's what I'm getting to, Where do you put those thresholds to maximize user autonomy? That's different than the medical question, which is where do you put those thresholds to maximize user heart health. If you just want to maximize heart health, well, in that case, then the red should be all the way down to even the very slim possibilities of a heart attack. Because if you only care about biology, if you only care about keeping someone healthy, well, then don't have any fun, don't drink, don't smoke, don't go travel, don't just exercise, right? Exercise and always be near the hospital. That's true. You could maximize your biological health that way, but you're giving up all of your autonomy. The question we were asking them is, well, let's not think about biological health for your product. Let's think about autonomy for your product. So if you make it all green, everything is green, well, then you're taking away from people's autonomy, at least the ones who are really have a good chance of a heart attack, because they probably want to know that for their lives, right? To make free and good choices. I guess this would be within the theory of the practical theory of autonomy. Within this area where we talk about freedom, our self-determination also requires information, like understanding the truth about the world. I think we're kind of in that zone here. You do help my autonomy, help me make decisions about my own life. If I really have a high probability of heart disease or heart attack, you really do help me if you tell me that. But if it's a very slight possibility, you don't want to say that I'm red, and you might not want to say that I'm yellow either if you want to maximize my autonomy, my ability to make free decisions about my own life. But if you don't want to make everything red, you want to make a lot of it green or a lot of it yellow, well, where do you draw the line? Is it a 10% chance of heart attack in the next 10 years? 20%? 30%? What's the number? That's a really hard decision. How can, and this is what we talked with them about. We said, look, because initially they were just thinking biologically. They just said, look, let's just make it red if there's any biological problem and green if there isn't. That meant almost everyone was getting red. So their lives were being wrecked by this, this test. The test was supposed to help them. It was supposed to help them live a better life. But it was making them live a worse life because everyone came out worried out of their minds about their heart rate or their heart health. So that's the first question I wanted to ask about Cardiccio, and I want to say that this is a question and shows how AI ethics intersects with the real user experience in the real world and with profit. I mean, Cardiccio's product was terrible because everyone was just worried out of their minds about having a heart attack. To make it a good product, to make it helpful to users, they had to take into consideration questions about user autonomy. They had to ask, well, how can we diagnose your health biologically perfectly? Instead, how can we maximize your autonomy in life with this health data? That's a really different project. And getting that project right is extraordinarily difficult. But that requires, amongst other things, it requires trying to figure out where to put these thresholds. At what point do we go from red down to yellow? So you go to the doctor right now and change your lifestyle and your habits and everything, down to be aware, maybe come back next year, do the test again, down to all good, get out of here, go live your life, don't come back, right? Or at least don't come back for 10 years. Where are those steps and how can you arrange those steps again, not to maximize biological health, but to maximize how the ability users have to make free determinations about their own existence. And then just some particular details there. There are all kinds of sub-questions here. Like what we were saying up to now, well, if someone comes out in really bad shape, you should tell them immediately. But then on the other hand, you have to remember that once you get that kind of news, human minds are not like computers. You can't delete information. You cannot unknow, just like you cannot unsee. We've all seen videos that we cannot unsee. Some are flashing in my mind right now. Right, that's a terrible thing. I can't erase it. We've all had that experience, right? Well, the same thing with information about your health. You can't unknow that information. So there's also, we were saying up to now that if it's red and really bad, you should tell the user that, but maybe not. I mean, maybe if it's really, really bad, maybe if Cardiccio knows you're going to die within 24 hours, maybe it's better to not tell them. Maybe it's better to just not say anything and just let the user live their last 24 hours living instead of being afraid of life. I don't know. That's a hard question, though. Are there ever times when Cardiccio, the company, should not tell the user what's going to happen to them? And if they decide that, how could they justify that? Can they justify that in terms of user autonomy? They can say, look, it's true for biological health, we should tell them, but for their life, in order to live freely and make their own determinations, we should just not tell them. Because if we do, they're just going to collapse in worry. Their last 24 hours are going to be a waste. We should just not tell them. And do they have the right? This is something we'll talk about later in the area of human dignity, but we'll just quickly say, I mean, there's also the question, well, I mean, do they have the right to not tell them? Or do they have the right to tell them? Oh, there's a lot going on, you can see. But just sticking with the idea of pure autonomy, what we're trying to do, remember, is maximize autonomy. And the question here is, first, where do we put those thresholds? At what point do we say, look, your situation is one, don't worry about it so much, go live your life, but come back next year. And your situation is, go live your life, don't come back for a decade. And your situation is, you've got to worry. Where do you draw those lines? And then, again, there's these special cases. If it's really bad, what do you do? And the decisions you make, if you make decisions in terms of user autonomy, are completely different than the decisions you will make if you make the decision in terms of biological health. And that's a mistake the company made. They started out thinking, we're a biological health company, which they are. And so we'll make our decisions in those terms, which they did. But that was a terrible way to make decisions. It was terrible for the profit of the company because people hated the service. Everyone came out feeling bad. And it was terrible for the life of the users, for their autonomy. So it's a good example. This is a good example of how AI ethics is necessary. If you don't have ethics in your applications, you will fail just like they did. Well, they didn't because they came to us. Okay, so that's one good case. Another good case. This one I did not work on myself. This is a general case, but it asks some good questions, and it's becoming increasingly important because of this idea of dynamic insurance. Dynamic insurance is happening everywhere now. Dynamic insurance is this idea that the companies, the insurance companies, say, if you have car insurance, they're gathering vast amounts of information now about how you drive, how well you drive, and so on. And I've already seen, I can't remember which company it was, but I was just seeing just the other day, there was an ad for car insurance where they said, look, we're going to put a kind of a reader in your car that determines how fast you're accelerating and how fast you're braking and that kind of stuff, how fast you're going, that kind of stuff. And then we will gauge your car insurance rate in accordance with that data. So, I mean, obviously, if someone's constantly driving 75 miles an hour in 55 mile an hour zones, that's not good. It probably indicates a likelihood of having a car accident. And so your insurance premium will go up. Whereas by contrast, if you only drive once a week and you never leave the city streets, so you're never going faster than 25 miles an hour, well, then your chances of having an accident, at least a accident which is very expensive, which totals the car, your chances of having an accident that ruins the car are pretty slim. So in that case, it seems like your insurance premium would go down. And so initially at least, this makes a lot of sense. And then there's a question about autonomy. There's a question, there's the commercial question, that is the profit and loss question. This should help insurance companies make more money because they can find people who are the larger risks and charge them a lot more money, and then maybe they will leave the company. That's what an insurance company wants, right? The insurance company wants to insure people who will never make any claims. Of course, that's what they want. So if you're offering car insurance, then you want to only insure, right, the so-called, the 80-year-old grandma who only drives to church once a week. That's your preferred client because that person is never going to have an accident. And so you want to get rid of the 22-year-old who's driving 75 in the 35-mile-an-hour zone. You don't want that for your client. And it's hard to cherry pick. It has been hard to cherry pick up to now, but with the new technology, it's becoming much easier for the insurance company to cherry pick in that way. So that's what's going on. That's what dynamic insurance is. And then you could imagine it's starting with cars because that's where you can get a lot of data, good data, really quickly. But it easily moves on to things like health insurance too. Like if you're wearing I'm not, but so I don't know why I'm showing you, but imagine you are wearing a smartwatch. If the insurance company sees, oh, look, I'm connected to your smartwatch and I see, and it's the health insurance, and I see that you have now stationed yourself on a mountain in the Alps at the triple, I'm not sure what the most extreme, but the triple Black Diamond X, don't go here, vertical drop run. I see that my client has just stationed themselves at the top of that run. That might be a moment if I'm a health insurance company where I say, wait a minute, we've got to raise your health insurance premium and raise it a lot, like right now. You could even imagine like the health insurance company saying like, ding, ding, ding on your phone, just as you're about to go down, don't go down that hill. We know from your experience skiing, from the other hills we've seen you go down, that you can't handle that hill. And we don't want to pay your medical bills because you break your leg on this mountain. So we could easily imagine a health insurance company doing that, just pinging you right before you're about to go down saying, don't do it, please. Question, is this kind of dynamic health insurance, is it helping your autonomy? Is it increasing your user self-determination? And again here, this is a really hard question because on the one side, like I said, in the case of the car or the case of the health insurance, you are signing up for this service. You are saying, look, I want to get the reason people would sign up for this, for the car one or the health insurance one, is because they want to live in a more healthy way and they think their premium, their health insurance, will go down. And that makes a lot of sense. And that's definitely, obviously, an autonomous decision. That's a decision of self-determination. You're taking control of your life. You're imposing rules upon yourself, saying, look, I'm not going to do this ski run, or I'm not going to do this, or not going to do this. Well, first I am going to impose the rule where I will let the insurance company set my rate. That's the first autonomy, self-determination. And the second one is that I will drive slower and so on so that my rate goes down. So it starts out, there's no question about it. It starts out as an autonomy choice. It increases your self-determination. It lets you make more choices about your own life. Obviously, everyone agrees about that. The problem is, does it become an autonomy trap? I mean, once you make that decision to go into the program where you give them all this information about you, then does it end up being a situation where you feel like your self-determination is being robbed from you? Because every time you think you want to do something like try, many of us live like that. We say, look, I'm ready to try this hard ski run. Maybe not the triple double black diamond, but we do want to challenge ourselves, and that's why we want to. That's part of the reason of why we want to be free. But if the second we go up there to do that, all of a sudden our phone starts ding, ding, dinging madly, right? Well, then maybe we're giving back that autonomy we thought we had gotten. Maybe now we're not as free actually to choose for ourselves. Maybe don't have the sensation that we're giving rules to ourselves about where or how we will live our life, or which ski run we will go down, or how we will drive our car. So how do you balance those two things? On the one side, when you sign up for this kind of insurance, there's no doubt that's an autonomy-boosting decision. I'm taking control of my life. I'm making a rule and applying it to myself. And I'm doing it for good reason, to lower my premium. But at what point, if ever, does it turn into a net loss? Does it turn out to be that because of this constant binging on my phone, right? I don't feel as though I can make decisions for myself anymore about how I will live my life. I'm not sure what that point would be, or even how you would measure that. But this is another example, like the Cardicio example, where you could imagine, right, a kind of curve where you say, look, to a certain point for the insurance company, when we offer people dynamic insurance, up to a certain point, it helps their autonomy. But after a certain point, it begins harming their autonomy or taking away their autonomy. And then you could figure out, if you're working for the insurance company, well, where is that point? How do we find it out? How do we discover it? And then you might want to ask subsequently, does that point, how does that correspond with, or does it correspond with profit for the company? Maybe it does, maybe it doesn't, but you would probably want to know that. You would want to say, look, if I'm looking to maximize the autonomy of my clients, am I also maximizing profit for myself? So those are two different curves which you would have to explore. And the maximizing the autonomy curve, that's a hard question. Right? As I say, you need to find some way to measure, some way to determine where the line is increasing and where it's decreasing. Maybe giving one warning is actually an autonomy positive, right? If you just give someone one warning and you say, this hill looks like a little bit of a challenge, think twice about it, maybe that's good, right? Maybe that helps me decide for myself if I want to do this hill. And maybe it's not good if it's like the seatbelt thing that goes in the car when you forget to put the seatbelt on. Say ding, 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 ding. Shut up, it just won't stop. Maybe at that point, it's taken away from your autonomy. And then, how do you find the intermediate point? Something like that is a hard project, but it's a terrifically important project. The insurance company wants to know. They want to know because they, just for profit, they want their users to be happy. They don't want them to feel like they're being incarcerated by their own decisions. They don't want users to feel like their freedom is completely destroyed by their own free decision to sign up for this policy. So both ethically, autonomy matters. But if you want to help people live better lives, you want to help the insurance company help people be free. But even if you don't want that, even if you don't care about social well-being and that stuff, even if you only care about making money, you still want to know. Because if you don't, people will leave your insurance, right? I mean, no one is going to support or bear signing up for a kind of dynamic insurance if they're getting warnings and ding, ding, dinging constantly about everything all the time. It will drive them insane. They'll stop. They'll cancel the policy, of course. So ethics and profit, they intersect again here. And then we have the theoretical question: how can I freely limit my own freedom? That's a fun question. Or can I freely limit my own freedom? That's a fun question just to think about, right? If I sign, it's an odd situation that I'm using freedom to limit my own freedom because I'm signing up for this policy. Like I say, it's clear that initially it's a freedom positive decision because you're applying rules to yourself. Right? You're deciding for yourself, self-determination to sign up. But at some point it might flip. All right, so why don't you take a few minutes to think about that question? I mean, is it possible for freedom to destroy freedom? Maybe not. I mean, maybe I'm formulating that wrong, incorrectly. Maybe if the initial freedom is a free choice, then you can't ever undo your own freedom, no matter what happens later on. I'm not sure.